The member for Ottawa-Vanier.
Thank you, Madam Speaker. My question is for the Associate Minister of Mental Health and Addictions. 2 weeks ago, the Sandy Hill Community Health Centre in my riding was notified that it must close its supervised consumption sites along with all the other ones in the province. Meanwhile, there are no hard hubs in proximity, and the closest one is already at capacity. So I want to ask the Minister, the Associate Minister, what is the government concrete transition plan for the people currently relying on these life-saving services, and will you allow providers in Ottawa to implement and receive funding for alternative models that meet the need of our community? Because right now, we're underserved, and with the closure of the site, people are just going to die.
We recognize the Associate Minister of Mental Health and Addictions.
Thank you, Madam Speaker. We are building a system of care. There's providing supports, recovery-based supports for those who are struggling with addictions, Madam Speaker. Unlike Liberals and NDP, we don't believe in providing tools for the most vulnerable in our population to use illicit drugs. Madam Speaker, don't take it from me. Take it from the Ontario Association of Chiefs of Police. I quote, police services and community partners have raised ongoing concerns regarding the impacts surrounding some sites, including public disorder, open drug use, needle debris, public health hazards, trafficking, exploitation, and increased demands on emergency and policing resources. With strong and oversight coordinated partnership, Ontario can advance recovery-focused solutions that support vulnerable individuals while maintaining safe, healthy, and resilient communities across the province, Madam Speaker. That's why we're expanding hot hubs across the province with $550 million in the province.
Back to the member for Ottawa-Vanier.
Madam Speaker, closing supervised consumption sites without a viable and accessible alternative does not eliminate the need. What it does is it shifts the burden onto our communities. And what the minister has described is true. It's going to increase. There will be more public drug use. There will be increased pressure on first responders and longer wait times in already strained emergency rooms. At the Sandy Hill site alone, there was over 250 overdoses that were reversed in the past 6 months. What's going to happen now? So I asked the minister, what specific evidence-based plan does this government have to replace the life-saving work currently being done by the Sandy Hill Community Health Centre and prevent these deaths from occurring in our communities?
Back to the Associate Minister for response.
Madam Speaker, the old model, the drug injection sites, it acts as a revolving door instead of treatment and recovery. People cycle through the system repeatedly, Madam Speaker. The new model, building on a recovery treatment model, Madam Speaker, it will break the cycle of addiction, Madam Speaker. That's why this government, under the leadership of Premier Ford, we have increased the hard hub funding 4 times more than the CTS sites, Madam Speaker. Madam Speaker, take it from Auditor General, Madam Speaker. Auditor General said the drug injection sites only serve 1,600 people every year, but the hot hub, all the 28 are operational right now, estimated will serve 45,000 people every year, Madam Speaker. Hot hub is all about from a simple cup of coffee, hot shower, warm meal, all the way to meaningful social, mental health support services where and when they need it, Madam Speaker. Thank you.